Welcome to Your Hopeful Healing Pathways. This video explores Chapter 8 of A Guide to Crisis Intervention by Kristi Kanel. Today we'll cover crises related to military service, including invisible wounds, combat stress, and military sexual trauma. By the end of this video, you should be able to describe military culture, recognize depression, PTSD and TBI as invisible wounds, discuss military sexual trauma, understand combat stress injuries from modern warfare, and apply interventions with veterans in crisis. Military culture is rooted in structure, discipline, loyalty, and a strict hierarchy. Service members are trained to prioritize duty over personal well-being. This can result in difficulty transitioning back to civilian life, where ambiguity and emotional expression are more accepted. Understanding this culture is essential for building trust with veterans in crisis. Many civilians are unfamiliar with the daily life and stressors faced by active duty personnel and veterans. This disconnect can create isolation and stigma, especially when service members feel misunderstood or unsupported by society. Crisis workers must approach these clients with cultural humility and an awareness of military norms. Not all injuries from war are visible. Post-traumatic stress disorder, traumatic brain injury, and depression are common among returning veterans. These conditions may manifest as irritability, flashbacks, hypervigilance, insomnia, and emotional numbness. Due to stigma, many avoid seeking help, which increases their risk of crisis and suicide. According to the DSM-5, PTSD includes symptoms in 4 clusters: intrusion such as flashbacks, avoidance, like avoiding reminders of trauma, negative alterations in mood and cognition, and hyperarousal such as an exaggerated startle response. Veterans may meet these criteria following combat exposure, injury, or witnessing death. Traumatic brain injury, or TBI, is often caused by explosions or blunt trauma during combat. Symptoms can include memory issues, mood swings, headaches, and concentration difficulties. TBI and PTSD often overlap, which can complicate diagnosis and treatment. Depression is a common co-occurring condition among veterans. The risk of suicide is significantly higher among veterans than the general population. The VA reports that approximately 17 veterans die by suicide each day in the United States. Early identification and crisis response are, absolutely vital. Military sexual trauma refers to sexual harassment or assault experienced during military service. Both men and women may be affected, though women report higher rates. MST survivors often experience shame, self-blame, and difficulty trusting others. Effective support requires a trauma-informed, non-judgmental approach. Modern warfare in Iraq and Afghanistan introduced new psychological stressors, multiple deployments, urban combat, civilian casualties, and the use of IEDs. These factors contribute to combat operational stress injuries, a concept distinct from PTSD that recognizes cumulative chronic strain. Crisis workers should assess biological, psychological, and social components of each case. Biological factors include TBI, sleep disorders, and chronic pain. Psychological aspects involve flashbacks, anxiety, and guilt. Social elements encompass isolation, unemployment, and family strain. This holistic approach supports more tailored interventions. Best practices for intervention include active listening and validation, cognitive behavioral techniques, trauma-informed care peer support groups, and referral to veteran-specific programs such as the VA or vet centers. Confidentiality is key, but the duty to warn still applies in cases of imminent harm. Barriers for veterans include fear of stigma, concerns about confidentiality, and limited access to culturally competent care. Crisis workers must build rapport, explain confidentiality clearly, and offer flexible options for support. Working with trauma survivors, especially veterans, can result in secondary traumatization. Crisis workers should engage in regular supervision, peer consultation, and self-care to avoid burnout and compassion fatigue. Military service can leave lasting psychological and emotional scars. Veterans may struggle silently with invisible wounds, but through understanding, trauma-informed practices, and timely intervention, crisis workers can help them reclaim stability and hope. This concludes Chapter 8. Thank you for being part of Your Hopeful Healing Pathways, where education meets compassion.